So when you look at healthcare marketing especially, across these huge, diverse markets in Asia, the amount of money being spent is just, well, it's staggering.
It really is. We're talking billions.
Billions of dollars, right.
Yeah.
Poured into these massive awareness campaigns. You see them everywhere. Huge billboards, those big digital displays downtown, social media blasts. But the real problem, the central question is, how do you turn that vague recognition into actual measurable action from a patient?
That gap, that's exactly what we're tackling in this deep dive. It's the chasm between seeing something online and actually doing something in the real world. We're exploring this approach called the online to offline, or O2O, Engage Suite.
O2O, right.
And this framework is really designed from the ground up to connect those fragmented campaigns and, this is the critical part, deliver real actionable insights to both patients and the healthcare professionals, the HCPs.
Okay, so our mission today is to really unpack the mechanics of that. We need to look at how this whole O2O system uses modern tools, we're talking AI, location intelligence, to actually drive that conversion.
And we're going to focus on two really distinct mechanisms.
The first one being captive media inside the clinic, and the second, this new way of engaging doctors called Agentic AI lead generation.
Exactly. And for you, the listener, this is really a shortcut. We're cutting through all the marketing speak to get to the core of how these, very sophisticated, very regulated digital channels are being engineered to actually improve health outcomes.
It's not just about selling a product.
Not at all. It's about driving real behavioral change in a super complex industry.
Okay, let's start where a lot of that money gets wasted, the traditional approach. The research we looked at calls it the Billboard Problem.
A very fitting name.
It is. We know traditional advertising out of home and digital out of home, it's great for getting eyeballs. I mean, the scale is massive. In a market like Malaysia, that sector is projected to hit almost $210 million in 2025.
And pharma brands are a huge chunk of that spend. But the finding is it's undeniable. Awareness without a clear path to action is wasted money.
It's just noise.
It's noise. And the data really points to this big psychological disconnect.
Okay, let's dig into that. That psychological failure is key, right?
Yeah.
Why does a billboard fail where this O2O approach seems to work?
It all comes down to context and timing. Completely. Traditional ads, they often use this very intense, sometimes fear-based messaging, like get checked before it's too late.
I've all seen those.
Right. But they reach you during what the materials call passing moments. Think about it. We're stuck in highway traffic, you're late for a meeting, you're trying to figure out where you're going. Health is the absolute last thing on your mind.
You might see it for, 3 seconds? It doesn't even really register.
Precisely. It's low relevance, there's no context for you to actually do anything, and the message just creates pressure, not empowerment. You can't absorb a complex health message when your brain is just trying to manage stress.
So that spend just fizzles out. It never turns into a doctor's visit. Because to act, you need the right context, you need confidence, you need a focused environment. So if the highway isn't the right place, where does this framework say the conversation should actually happen?
The answer is so simple, it's almost elegant. It's the moment a patient has already decided to prioritize their health.
When they're in the clinic.
Inside the clinic, in the waiting room, using what's called captive media.
That reframes the entire opportunity, doesn't it? Your mental defenses are down, your focus is already on your health.
It's a fundamental shift. Captive media transforms that dead waiting time into proactive awareness time. Instead of competing with traffic, the brand is now showing educational, disease awareness content on screens inside the clinic.
And the network is huge. Our sources cited, 209 clinics nationwide?
Over 209 clinics, reaching more than 5 million viewers a year. So the audience isn't just captive, they're actually primed to engage with health info.
And this is where it gets really interesting, right? Because it's not just about showing an ad. The goal is to actually spark a conversation. The research we saw details this 3-step mechanism. It's called the conversation trigger.
Right, and it's all about making the patient the proactive one. So, step 1, the patient is in the waiting room and they see this content on the screen. It's purely disease awareness, let's say, about colorectal cancer screening.
No products, no brands.
None at all. Then, step 2, this is the interactive part.
The QR code.
Exactly. The QR code, they scan it, and it takes them immediately to Nora, this specialized AI-powered symptom checker, so they can privately self-assess their own risk factors right there on their phone.
So Nora is basically triaging them in a way. It's asking focused questions.
Highly focused. It's designed to qualify their risk based on local medical standards and get them ready for the doctor. It might ask about frequency, severity, family history. All that data gets compiled into a quick, structured summary.
Which sets up the payoff. Step 3, the conversation trigger.
That's it. When the patient finally sits down with the doctor, they're not starting from scratch. They're empowered. They can say, "Doctor, I saw the information on the screen. I used this tool, and I'm concerned about this."
And that one moment, that's the huge behavioral shift. The patient has basically pre-qualified themselves. They've opened the door. The doctor doesn't have to fish for information. They have a motivated patient right in front of them.
It turns a marketing impression into a measurable clinical starting point. It's a massive change in the dynamic.
But we have to address the elephant in the room,
Right.
the regulatory side. Pharma marketing is so tightly controlled, especially in Asia. How do you run content inside a clinic and stay compliant?
It's a huge challenge, and the framework addresses it with surgical precision. It's all about their MAB KKK LIIU compliance strategy. For our listeners, that's the regulatory body for medicine advertising in Malaysia.
So what's the strategy?
It's basically a firewall. The captive media content that the patient sees is strictly educational. Disease awareness only. No product names, no company logos on those patient-facing screens.
And the product-specific stuff?
That's completely restricted to the HCP, the data sheets, the clinical summaries. That's all delivered through digital leave-behinds or secure portals only doctors can access.
So the patient gets the education to start the conversation, and the doctor gets the evidence they need to diagnose and prescribe. It's a really clean, compliant way to get visibility in a trusted environment.
An elegant solution to a very tricky problem.
Okay, so that's the patient side, but that's only half the equation, right? Patient action doesn't mean much if the doctor isn't engaged and ready to act. Let's shift gears to that other critical audience, the healthcare professional.
Engaging busy HCPs is, well, it's a minefield. The data we looked at shows how badly traditional lead generation for doctors is failing. They are just overwhelmed.
The ad fatigue is real.
It's so real. One statistic was striking. 64% of HCPs report feeling extreme ad fatigue from the amount of digital content pharma throws at them.
And it's not just fatigue, it's inefficiency.
Exactly. Traditional methods give you terrible lead quality bots, non-doctors signing up. But the biggest issue is the drop-off rate, because doctors absolutely hate spending time on long, impersonal online forms. Time is their most valuable asset.
Every minute filling out a form is a minute they're not with the patient. You can't afford that friction.
You can't. Which is why this O2O suite introduces a completely different approach. Conversational AI on a channel that doctors actually use all the time.
Which in Asia is overwhelmingly WhatsApp.
Overwhelmingly. I mean, WhatsApp has 2.5 billion global users, but the key stat, the one that really matters, is the open rate. It boasts an astonishing 98% open rate.
98%. Just think about that. You compare that to maybe 20, 25% for a good email campaign. It's not even in the same league.
It's a game changer. It turns a one-way broadcast into a guaranteed dialogue. So let's break down how this Agentic AI lead gen engine actually works.
Let's define Agentic first. How is this different from a normal chatbot?
That's a great question. It's the difference between being reactive and proactive. An agentic system is designed to act on behalf of the company to achieve a specific goal, like getting a qualified doctor to register for an event. It's not just answering questions, it's actively driving the process forward and removing friction.
Okay, so walk us through that process. How does it unfold?
It starts with conversational outreach. So targeted, compliant WhatsApp messages are sent to specific doctors, inviting them to something high value, like a live case forum or a CME webinar.
And that leads right into the next step, qualification.
Correct. But instead of sending them to a landing page with a dozen fields to fill out, the AI just asks a couple of screening questions right there in the chat. Just enough to segment the lead, confirming their specialty, their region, that sort of thing.
So only high intent, correctly identified doctors move forward.
Exactly. And then you get to the final and most important step, frictionless conversion.
This is the magic part.
It really is. The high-intent leads get their registration confirmation or a calendar invite right there inside the chat. The doctor might literally just have to reply yes to confirm, and 30 seconds later, the invite is in their mobile calendar.
That's radically efficient. The example from the materials was so clear. Dr. Lee, a busy gastroenterologist, gets a WhatsApp about a colorectal cancer webinar. He taps join, answers 2 quick questions in the chat, and boom, it's on his calendar. No forms, no passwords.
That kind of seamless experience just demolishes the drop-off rates you see with traditional marketing. And it also aligns perfectly with what's known as the HCP5A journey.
Right, which tracks the doctor's path from awareness to action. Which parts of that journey does this cover?
The chat strategy nails the first two phases. Away, which is that initial spark of interest, and ACT, the curiosity phase where they interact with the AI. By making that so easy, it fast-tracks the doctor right to the final phase. ACT, which is them actually attending the event or eventually prescribing the solution.
So if we pull back now, the real power here is that these aren't two separate systems running side by side. It creates a continuous loop.
Exactly. It connects the in-clinic captive media on the patient side, which creates that informed demand, with the agentic AI on the HCP side, which makes sure the doctors are supported and ready to meet that demand. That connection is the core value for pharma.
Let's talk about the bottom line then. ROI, measurability. Pharma has always struggled to connect a billboard ad to a prescription written months later. How does this framework change that?
It pulls them out of that world of vague impressions and into fully measurable outcomes. Because the entire journey is digital, they can track everything. We're talking patient impressions from the screens, the number of QR scans, how Nora is being used, referrals, and specific doctor engagement with the CME content.
So they get real, evidence-backed ROI. They can clearly see how money spent on captive media led to a patient inquiry and how AI engagement drove physician attendance.
And this isn't just a theory. The model is proven and scalable. It was validated through the nationwide Dr. Mata ophthalmology program, which used this exact framework to reach those 5 million annual viewers.
Which means it's ready to be expanded.
It's ready for other critical areas where patient activation is everything: oncology, obesity, cardiovascular health.
So the ultimate takeaway here is about trust, really. The pharma brand moves beyond just being a product seller. They become a partner in better outcomes because they're literally facilitating that crucial first conversation between an informed patient and a supported doctor.
It accelerates the entire care pathway. So, to summarize our whole deep dive, we've really explored how strategically placed media and frictionless AI can transform healthcare marketing from this fragmented, expensive mess into a measurable, compliant, patient-activating engine that closes that gap between digital intent and real-world clinical action.
This has been fascinating, just walking through the mechanics of how technology is being used to overcome these huge behavioral and regulatory hurdles.
And as you think about this shift in how businesses engage with experts, here's a final provocative thought for you to consider. If conversational AI can hit a 98% open rate and build trust with busy doctors by getting rid of friction, what other professional fields think complex B2B sales and finance or specialized engineering that still rely on those awful high drop-off lead forms are poised for a similar chat-driven agentic revolution?